let's roll into fat transfer.
Okay.
And we're also going to talk about the new pure graft, right? But first, share with the viewers, what exactly is a fat transfer?
Well, fat transfer in a nutshell is taking fat cells from one part of our body and moving them to another part of our body. So areas that we may have extra fat, and this, by the way, can be done as part of a contouring procedure, say if our flanks or our tummy are bigger than we want and we want to actually change the contour of that, or it can be done just to get enough fat for the purpose, and we're not really concerned about the contour of the donor site, we're just taking enough fat from there. But we take that fat, we prepare it specially as a graft, and then we can inject it very much the way we would inject a filler like Juvederm or Radiesse or something like that to change contours or volumes or things of that nature.
And so what are the most common areas that a person might have a fat transfer?
I would say the most common areas that are routinely done electively are areas of the face, the breasts, and the buttocks.
Okay. So when a patient comes in for a fat transfer and you're going to use the new pure graft, how does that benefit the patient and in having their fat transfer?
Well, fat transfer is a very highly technically dependent procedure. So it depends on how the fat is harvested, it depends on how the fat is prepared as a graft, and then it depends on how it's injected by the injector. So that middle component, how it's prepared as a graft, there are lots of different ways that this can be done, from filtering it through like a cheesecloth or a gauze to putting it in a centrifuge, which is a device that spins it quickly and separates out the fat from the fluid. I favor a device called PureGraft, which is a newer device developed by the Satori company. Now PureGraft is marketing it. And it basically looks like a little IV bag, but it's sort of like a little mini dialysis chamber. It's got a filtration mechanism inside there, and you put your fat directly into that. So either you harvest the fat through liposuction or you use a syringe to harvest the fat. You can inject it right into the PureGraft. You put some saline in, it washes it, it goes through that filtration section. There's a drainage bag where all of the stuff that we don't want to inject back into the patient, like broken cells and blood cells and fluid, goes away, and we're left with pure fat cells that can then be drawn out of that harvest chamber of the PureGraft bag and injected directly into the patients. So for me, it avoids open air contamination of the fat. You know, we're not straining it over a cheesecloth or taking it out, putting it in a centrifuge or anything like that. It's all a closed system. I think also the studies that have come out showing the numbers of viable or living fat cells that come out of the PureGraft are higher than other techniques. So all the way around, for me, it's been a great device for purifying the fat.
So if a patient has enough fat to harvest for their face, to volumize their face, that they also could maybe use fillers as one of their other options, but they really want to use fat because it lasts a little bit longer, right?
Yes.
Is that something you can do in your office, or do they need to be have a surgical procedure?
Well, that's a great question, because the PureGraft company has just come out with a new version of their unit, which I think is going to make it a reality to do in an office exam room setting.
Wow.
And even though you can do that with a centrifuge or straining on a cheesecloth, again, if you favor the PureGraft technique of fat purification the way I do, they've come out with a new bag that's it's only about this big. It's a 50 cc bag, which really is about all the volume you need to volumize a face. We don't need a big volume. You know, buttocks, we may be injecting 400 or 500 cc's or more into each side of the buttock. But for the face, it's much smaller quantities. And so it makes it now a reality that under local anesthesia, we can take a little bit of fat from around the belly button or the inner thigh, put it into this PureGraft bag directly from the syringe. We don't even need a liposuction machine to do this because we're dealing with such small quantities. It stays in a closed system. It purifies through the PureGraft, and then you put it right directly into your syringes for injection. So it almost becomes like injecting a filler in a treatment room setting.
Well, that is really totally awesome. I'm totally excited about that because I've used fillers in the past, and it's like you just have to continually use the maintenance. But once you know how you like your face, once you've used that filler, knowing it does go away, that's when you're ready to do the fat transfer because you know it's going to be permanent.
Absolutely, and that's probably the big advantage that fat grafting has over fillers. You know, I love fillers, they're wonderful. They offer a lot of advantages, and one of them for some people is that it's temporary or that it's easy to do because you can just pull a filler off the shelf. But for those people, as you said, that want a more permanent lasting result or don't want to use something that's not their own tissues, fat grafting is a perfect solution.
So a patient comes in, they want to have a fat graft from their belly to their volumize their face. What is the time allotment that they should allow for that?
To do the procedure, I would say probably to volumize the entire face. Now, bear in mind that we don't have to necessarily do the entire face. We might have just one area that's of concern to the patients, like maybe around their eyes or maybe their temples or brows or something like that. But assuming that we're going to volumize the entire face, I would say the whole procedure might take a couple of hours from start to finish.